Good afternoon, everyone, and thanks for attending our latest Behavioral Sciences and Social Medicine Community Rounds presentation. Today, we're very pleased to have three wonderful speakers to discuss their efforts in supporting healthy aging at health system and community levels. And believe it or not, I was telling the group here just a few minutes ago, this starts year 2 of these community rounds presentations. So we're very pleased about that. And we tried to present a breadth of topics, but we also need your help. So if there is anything that you're interested in hearing more about during these presentations that we do once a quarter, please feel free to use the chat to put any suggestions for topic areas. So we'd love to consider those. Also, please note that we will hold questions until the end during our designated question and answer period, but feel free to use the chat throughout to ask questions or pose questions, make comments, and share relevant contact information if you would like to do so. This presentation is being recorded, so you can access it later on. We'll send out a link after the fact. So now I'd like to introduce our first two speakers who will be presenting together. The first is Nicolette Castagna, who has background in public health and aging with a specialization in clinical mental health care. She served on the FSU Department of Geriatric's HRSA-funded North and Central Florida Geriatrics Workforce Enhancement Partnership Team since 2015. Nicolette has experience working to support system change towards geriatrics care improvements in a variety of places, including federally qualified health centers and memory care settings. She works to train a variety of healthcare and mental health professionals on the nuances of caring for older adults, and also works as the program counselor for the Tallahassee Senior Center's Upslide program. And then Dr. Paul Katz is professor and chair of the Department of Geriatrics in the FSU College of Medicine. He's a widely published author and noted speaker on aging issues, and has previously served as chief of the Division of Geriatrics at the University of Rochester School of Medicine, and for 16 years was medical director at Monroe Community Hospital, which is a highly regarded academic nursing home in Rochester, New York. Dr. Katz has received federal grants from the National Institutes of Health, the U.S. Veterans Administration, and the Health Resources and Services Administration to study various aging issues. So without further delay, I will turn it over to Nicolette and Paul, who will be co-presenting today.
Thank you so much. I guess we'll wait for the slides to come up. Nicolette has told me I have 5 minutes to go through these first few slides. So I may do it in 10, but I'm going to be setting up a more in-depth conversation that Nicolette will take over, really reviewing some of the work we've been doing with our Geriatric Workforce Enhancement program over several years. So much of this could not have been done without Nicolette. What we'd like you to do is gain an awareness of some of the, give you some insights into this training project, and particularly how it relates to community collaboration and the many linkages that support the age-friendly health movement. We'll get to that in a minute. Next slide, please. So one of the unique things about HRSA's Geriatric Workforce Enhancement Program grant is that it aligns so nicely with the college's mission, which is listed here. I don't have to remind you, but basically the focus for HRSA has been over the last several years vulnerable populations, specifically older adult populations, and those living in rural areas. And I'll show you a minute how we try to align our grant activities with both HRSA's goals and the mission of the college. Next slide. So we're not going to go into depth. We were lucky enough to get the initial GWEP, if you will, funding in 2015. And these were some of the projects that comprise that grant. And many of these gave us not only experience, but led into the projects we'll be talking about in a little more depth in the next few minutes. Next slide. So one of the core premises within HRSA and the GWEP grants is to facilitate or even create age-friendly health systems. The age-friendly care movement, as many of you know, and is noted here, follows in a set of evidence-based practices, causes no harm and aligns with what patients and their caregivers and loved ones want, what matters most, if you will. So age-friendly health systems basically require that you provide high-quality care in what has been termed the 4 M's: mobility, such as falls; mentation, such as depression, delirium; dementia; medication; and what matters most, which is comprised about advanced care planning, et cetera. So each grant, particularly ours, incorporates this framework into all of our activities whenever possible. Next slide. Our current catchment, we have 5 projects, and not to go into depth in this, but again, this shows you how we try to align our projects with the counties that were in rural health areas, that were medically underserved areas, and were defined as primary care shortage areas. And I'm sure this had a good deal of, one of the reasons that we did get funding is because of this alignment. Next slide. So I'm going to go briefly over 4 of our existing 5 projects and then hand it over to Nicolette, who will go into depth about the federally qualified health center, which she works intimately with. So one of the projects, African American Alzheimer's Caregiver Training and Support, led by Dr. Rob Glukoff and his team, is really focused on African American caregivers who are caring for loved ones with dementia. And it's really focusing on their mental health challenges and problems. Next slide. Our partners through Rob's team is African American faith-based community organizations, College of Social Work, and also consultation with the Mayo Clinic in Florida. And the impact, which we've had significant, is really to improve caregiver mental health through a number of means, particularly one-on-one cognitive behavioral interventions, as well as more broader education and information sharing among groups. Next slide. The third project is improving the lives of residents with Alzheimer's through Montessori-inspired lifestyle training. This is training that is specific to those individuals in memory care units who are suffering from dementia and have behavioral issues. So the focus of this is to partner with community-based organizations and state agencies to provide this dementia training, as well as a number of other resources to community members, of which Nicolette has been at the forefront, such as first responders and financial advisors, all with the goal of promoting dementia-friendly communities. Next slide, please. Our project partners are Center for Applied Research in Dementia, which is based in Cleveland, also the Florida Department of Elder Affairs and their Dementia Care and Cure initiative. The impact, as I said, is on training staff on patient-centered care approaches for those living in memory care units with dementia in assisted living. Next slide. The fourth project is partnering for quality care by building effective collaborations between home care workers and family members of their clients. And here the goal was to partner with community-based organizations to improve the quality of care for older adults by enhancing the relationship that they have with the home care workers and as well as the families. Next slide. Our partners for this project was an organization called PHI, Paraprofessional Health Institute, which is based in New York, but has national outreach, and locally with Home Instead Senior Care franchises. And here we're improving relational competencies between the home care workers and the families that they care for. Next slide. And finally, the last project I will talk about is basically geriatricizing our physician assistant training program here at the college, integrating geriatrics into the PA curricular activities with evaluation components. This has been led by Ben Smith and Lisa Granville. Our partners, obviously, are Department of Geriatrics and the PA program here. And it's really to improve knowledge and skills of physician assistants to provide age-friendly healthcare. And I must say, we don't have time to go into this. Fortunately, we've been successful on delivering on many of the objectives that we initially sought at the beginning of this grant. So without any further ado, I want to hand it over to Nicolette, who will be going into depth with our very successful collaboration with North Florida clinics. So Nicolette.
Thank you, Dr. Katz. Appreciate that overview. As you all heard, we have a lot of different project activities, and we wish we had more time to tell you more about everything, but that'll give you a little taste of some of the work that we've been up to the last few years. So this project is really focused on health systems. We are working with federally qualified health centers or community health centers, which are such an important type of clinic and type of healthcare environment that serves low-income individuals, underinsured, uninsured individuals. They're really a safety net for areas of the country that do not really have healthcare services available. So we're very fortunate to be able to work with North Florida medical centers. The map you see on the screen is where they have clinic locations throughout North Florida, from Taylor County to the east, all the way over to Okaloosa County in the west. And as it's pretty well known, there's a lack of training across primary care, across medical specialists in the care nuances of older adult patients. So it's why our GLEP grant funds exist through the federal government, and it's really our main overarching mission is to improve training, improve care competencies of older patients across different types of professions. So we're trying to transform North Florida's clinical environments into integrated geriatrics and primary care health systems. And another thing we're doing is to really try to expand their knowledge of programs and services that support older adults just beyond physical healthcare needs, really reaching into that, social determinants of health spectrum. So increasing referrals, increasing care coordination in the surrounding counties of Tallahassee area. All right, so our partners, as we've said, are North Florida Medical Centers. They're a nonprofit, federally qualified health center serving North Florida. We're also working with the Area Agency on Aging of North Florida, Advantage Aging Solutions, and at a minimum trying to educate North Florida Medical Centers providers and staff about the way that supports and services are provided through the state, through the feds, as a single entry point system with the area agencies on aging. So making sure they're aware of the elder helpline to help patients get their needs met. And that's kind of where some of the partnership with the AAA comes in. We're also fortunate to work with the Alzheimer's Association. They have a health systems initiative that's working sort of with as a consultative model with hospital systems, primary care clinics, to again help improve the addressing dementia in those settings. We do have a video series, so a lot of the trainings we've been doing are offered virtually, so we can have a greater impact, reach more people, be more efficient in those training modalities. So we have recorded a 3-part training series led by Dr. Gloff, who's our other faculty lead with this project. He's a geriatrics faculty down in Immokalee. And that training series is on working with dementia in primary care. That's available via YouTube. We can share that out after the presentation today, but just want to know that's available to anyone that's listening, anyone that's interested. And of course, we've also been working with our Fsu Senior Health. Some of the lessons that we've learned with our FQHC system has helped them to kind of look a little closer at their care processes and, work together as a practice. So our impact, I'm going to get more into our impact of this project and just some of the ways that we're reaching, that we're working with our partner. So kind of how it goes is we start off with one clinic at a time. So far, we've worked with 5 different North Florida Medical Center clinics. They have 10 across the state, and we've spent a lot of time and and looked really closely at their current practice and got to know their staff from reception to providers. We do this in a site visit. The picture that you'll see on the screen is we've had to get creative in these times, and we have Dr. Gloth down in Immokalee. So I kind of walk around the clinic with him on Zoom on my laptop. I go in person, he's there virtually. And this is a chance for us to just meet with the staff, listen to their concerns about caring for older patients, what goes well, what would they like to work on. And it just helps us to observe practice, observe care of older adults, and validate what it's like for them to work with these types of patients in their setting. So it's a nice opportunity to get a baseline understanding of practice in the clinics we're working with. And we do use the Institute for Healthcare Improvement. They have excellent materials that are free, that are available on their website, that help guide practice improvements related to integrating the 4 M's of care. So check that out if you're interested, and there's a link here. We use that as kind of our model for our site visits and for our baseline assessments. We're fortunate to have done a lot of different lunch and learn trainings with the clinics, focused on topics such as advanced care planning, dementia, the importance of geriatrics assessment, some of the unique things you need to screen for with older patients. And recently we've been doing a monthly case consultation meeting with our geriatricians and many of the providers at their clinics. This has been really successful and I think really needed, and a great opportunity to get in the weeds a little bit more about some of the complex patients that they serve in their clinics. Of course, if you can't improve what you don't measure. So we have a set of quality data that we're tracking, that we gathered baseline data for, that we're looking into periodically, different time points of pulling data through great work of North Florida Medical Center's EMR director. We could not do it without her. She produces reports for us for grant reporting and just for the organization to see what progress has been made. So we do track those to monitor change in practice. And like I said a little bit ago, another area of this project is to increase awareness of and referrals to supports and services for older adults. This includes evidence-based health and wellness programs that are more focused on preventative health, health literacy improvements, managing chronic conditions, those kind of really awesome classes that can help patients to be more empowered and improve their adherence to treatment, understanding of what's going on with them. So some things that we've been successful on despite the pandemic, we've really made a great impact working together with North Florida. One of the things that's been a universal change across their clinics is not only screening for high blood pressure or hypertension, but also looking at low blood pressure and taking orthostatic vital signs as part of their triage process when older patients come into the clinic. We've been able to look at the environment. Is it accessible to older patients or patients with disabilities? They now have, corporate has invested some dollars into making changes to their clinical practices, automating entryways, getting exam tables that lift and lower for easier access. And then we also have hearing assist devices that each of the clinics use. So when a patient comes in with hearing impairment, they can, it's these little headphones, it's a pocket talker, kind of a simple device, but it helps to increase, privacy, and patients have a better experience when they can communicate with their healthcare team. We do have a focus on Medicare annual wellness visits. This has been a great opportunity for the clinics to address a lot of the care nuances of older adults. Medicare annual wellness visits include a lot of preventative screenings, checking for falls, checking for cognitive impairment. So that's become a routine part of their clinical process with their Medicare patients. Another thing to highlight is East Point Medical Center, which is down in Franklin County off Highway 98. They have especially an amazing champion in their clinic, nurse practitioner Doris Carmichael, and she's really led the efforts of them being recognized nationally as an Institute in Healthcare Improvement age-friendly health system participant. So we're really, really proud of them. Just quickly, some clinical outcomes. We've seen some great improvements in documentation of advanced care planning or healthcare surrogate in the medical record. And when we started in 2020 looking at this, only 20% of patients over 65 had this noted. And currently in the Wakulla Panacea site, this is at 75% of patients. So a great improvement over the last few years. It wouldn't be a healthcare improvement project if there weren't challenges. So some of the things that can be difficult are just some of the restrictions in their EMR. We've been noticing that there's a lot of duplication of patient paperwork, but this is because kind of each type of visit has its own field in the EHR, and they don't necessarily sync up and talk to each other even within their own EMR. So just some of those challenges with the electronic medical record system. Time. So patient visit time. A lot of, often with older adults, it can be helpful, especially when you're meeting with a new patient, to spend a lot of time getting to know them, going over their concerns. And with short visits, because there's needs to be uniformity with the way that FQHCs are structured and their payment model, we're not able to really expand the type of visits or the length of visits. Of course, there's shifting system priorities. COVID, a lot of things were not possible during the last couple years. So we just have to be on our toes and be adaptable to what the healthcare organization is needing to face. The federally qualified health center serves a lower socioeconomic status population. People are not understanding what's going on with them. It makes it harder for them to follow through with their treatment plans, and it just takes a lot more time for care of older patients. Drug costs are really high lately. People are limited income, fixed income populations. And in these rural counties, something that you really hear universally in rural healthcare, transportation constraints. People are not driving, and they have a really hard time, taking a 40-mile trip to get to their primary care medical home that is their clinic at North Florida Medical Centers. And just limited access to care in surrounding areas. Simple things like getting blood work or getting imaging done can be burdensome to patients that live in these areas. Okay, so we're not only looking at improvements of healthcare, but we're looking at the whole community and these different domains of being more inclusive and more supportive to allow older adults to continue to be active participants in their community. So with a lot of the different partners that we have, we're touching on these 8 domains of livability that you'll see on the screen. There's a lot of movement across the US. Our population is aging at a pretty rapid level, and we need to be ready for it in all different sectors and all different aspects of social support, social determinants of health, not just healthcare. So what our program does and our partners do is, we really address a lot of these domains. We provide social supports and services. We provide health and wellness promotion. We're trying to increase health literacy, increase patients' empowerment to be prepared when they go to their healthcare appointments, know what's available to them, understand their own conditions a little bit better. Tallahassee is a recognized age-friendly community. We are working more on the peripheral of this, but a lot of our activities do completely align with this important work. We have our REACH website, which is really centered around anti-ageist language, looking at that respect and social inclusion for older adults, trying to provide print material. We use social media. We're trying to provide access to information and communication through modes that are available to older adults. There's also a lot of different civic engagement efforts, and the Tallahassee Senior Center is going to talk to you a lot more about this kind of work, because really they're the leader in our city for this age-friendly community activities. But some of the things we do is we try to include older adults in our activities. With our Stride work this past summer, we had older adult and the high school students interviewed each other to try to increase understanding between the generations. We have our senior mentor program, and there's just a lot of different ways that we are addressing the livability of Tallahassee and surrounding areas. All right, I'm going to skip this slide for the sake of time. I want to highlight some specific areas where we've been able to partner with the Tallahassee Senior Center. We were fortunate to get some supplemental funding through HRSA, through the CARES Act, and that allowed us to primarily focus on increasing comfortability with telehealth. We had such a rapid shift to having to receive services virtually. For so many people, this was brand new to them. So it was not only educating older adults how to do it, we were working with our students on how to be comfortable providing care via telehealth. This picture on the screen is an example of an article that we wrote partnering with the Tallahassee Senior Center, providing easy to understand tips for older adults to have successful visits via telehealth. We're also able to order medical devices, order blood pressure cuffs. So when people couldn't go into their appointments for those routine checks, or they weren't able to access the Tallahassee Senior Center for their free blood pressure screenings, they could do it at home. So with that, we purchased the cuffs, we've disseminated to older adults in the community, but we also recruited PA students to deliver a presentation to those older adults explaining blood pressure, helping to demonstrate how to take your blood pressure at home. So again, we're training health professions while we're also training older adults themselves. Then the last thing I want to mention is we partnered with the Tallahassee Senior Center Upslide program. And Melanie's going to tell you a lot more about that in a couple minutes. But we were able to create a facilitator guide. A lot of the work that we do through our HRSA grant is workforce training. It's kind of a train the trainer model. So this was a way for us to support the Tallahassee Senior Center's ability to disseminate their award-winning program across the country by creating a facilitator guide to try to expand the Friends Connection group, which was really vital for a lot of older adults during COVID to be able to stay socially connected. So just a couple links to share. I think we'll put these back up on the screen at the end so you all have a chance to check those out or jot down where I'm pointing you to. But at a minimum, please check out our REACH website, reach.med.fsu.edu. We have different pages for caregivers, targeting caregivers. We have pages targeting older adults. And then we have a lot of different professional trainings, tips, really focused on organizing the information through the 4Ms care model. The age-friendly network is run through the AARP. At a minimum, just be aware that this is happening across the country, and there's a lot of opportunities for us to get involved. I think there's a lot of alignment with the College of Medicine's mission. So check out, what that entails, what's happening in Florida. Other cities in Florida have age-friendly communities, so see where you might want to get involved in that, and a link to the Institute for Healthcare Improvement activities. All right, so there's my email and phone number, and we'll probably put that up again at the end and have time for questions, but I really appreciate your attention and learning about all the different ways that we're trying to support and increase quality of care for older adults.
Well, thank you, Nicolette and Paul. That was an excellent presentation. And one of the things that really struck me is, and I was about to say no pun intended, but maybe I do mean this in that way, the reach that you all have here in terms of how many people you're impacting, the number of community partners you have. I know you glossed over that slide, but I caught it very quickly and was immediately impressed. So thank you for that. So now I want to introduce Melanie Lachman, who is going to be our next speaker. She is the coordinator or program coordinator for the Upslide program at the Tallahassee Senior Center, where she helps connect older adults with activities and programs with the goal of enhancing mental, emotional, and physical health. Melanie has over 20 years of experience as a licensed clinical social worker doing individual and group counseling and community outreach. She came to the Senior Center from Big Bend Hospice, where she worked for 14 years as a grief counselor. and is very passionate about helping people realize their worth and reach their full potential regardless of their age. So with that, I will turn it over to you, Melanie. Welcome.
So thank you. I am indeed going to talk to you about the Tallahassee Senior Center. Specifically, I'll be focusing on our health and wellness program and the Upslide program. And the Upslide program is part of the health and wellness program at the center. So I just wanted to show you the mission of the Senior Center so you could see how well what we do in our health and wellness programs and what we do with Upslide aligns with what we do overall every day at the Senior Center. So the health and wellness program, what we do is, this list is not all inclusive, but this is a really good overview. And our focus with everything is empowerment, overall wellness, and healthy aging. We try to do everything with those things in mind and to also have just a very holistic view. So chronic disease prevention and management is sort of a thread that runs through everything. And I think you'll see that as I go through. Nicolette talked about the blood pressure cuff distribution, but just about everything we do has this thread. And you'll also see the thread of sort of the holistic approach with like the meditation and the mindfulness. We've done, before COVID, we had Reiki and massage here regularly at the center. That hasn't come back. Hopefully it will shortly, but there's just always this large overview of what we try to do. We also have partnerships with all of these varying organizations that train students to become healthcare providers and with healthcare providers. So we do regular orientations with medical students. We regularly have nursing interns. In fact, for Upslide, we had a little pilot program before we applied to get our grant, and it was a Kaiser occupational therapy assistant intern who did that for us and who showed us that there was really the need to do the Upslide program. But I just wanted for you to see that, you know, we have over 100 partners, but the health and wellness program specifically partners with many of our organizations that train students and healthcare providers. We provide individual assistance as well to our participants. We're not, providing medical care, but Ruth Nickens, who is our health and wellness coordinator and who came up with the idea for the Upslide program, she's got an open door policy. People can come in and ask questions and get information. She helps out when we have emergencies, when we have falls, which we do from time to time. We have a closet where we can give out durable medical equipment. So these are all just ways we're helping individuals. We're always doing health education. We have over 180 programs and activities every month here, and many of these fall under this category. So Ruth will often look at whatever, a spotlight chronic disease or something like that of the month. But I wanted you to see her senior safety series, which is very holistic. I did a presentation on emotional safety. She's got vaccine safety, environmental safety, just always looking at the whole person. We do a number of screenings. We have regular blood glucose and blood pressure screenings here, but we also bring in periodic memory, depression, balance screenings, and we have a podiatrist who comes in regularly as well to do screenings and care. Fitness classes are a huge part of what we do here at the Senior Center. So there's 20 opportunities each month at 10 locations. There is a fitness class going on every day here at the center. Our instructors are certified, and we want everybody at all levels of mobility to be able to come. Most of our fitness classes start seated or have a seated option, and there might be a portion where they're encouraged to stand, but those folks who want to remain seated certainly can. Really, the only ones that don't kind of fall into that model, we have an evening yoga class and Tai Chi, which is largely standing, as you probably know. The other thread that runs through everything in health and wellness is falls prevention. So I've already talked about screenings and the education classes. And so we're always trying to encourage folks in that. Tai Chi is something that is wonderful for that. When people come in, we'll try to kind of have them start out with like a lower level of fitness class, and then hopefully Tai Chi can be a goal in that in addition to our educational programs. We have a new program that falls under health and wellness called Fitness and Outdoor Opportunities Together, or FOOT. Right now, it focuses primarily on monthly hikes, but as part of the Lifelong Learning Extravaganza this month, we're having a Foot Expo, which is all things outdoor Tallahassee for older adults. So we're hoping to expand what we do with that. We're excited about that. Mental health, of course, is something that cannot be ignored, especially if we're looking at holistic. So for the past 6 years, I want to say it is, we've done every October, we've done a mental health event where we invite an expert to come and speak and just share their information with not only our participants, but the wider community of older adults. This year, it's going to be anxiety. And we're very much looking forward to sharing that. And we thought this was very, very relevant with regard to all the anxiety all of us have been feeling these past 2 years with COVID. But also under that heading comes Upslide. So Upslide, our goal is to break the cycle of loneliness and depression, to bring people to each other, to enhance people's social engagement. We originally were funded by the Florida Blue Foundation, got a 3-year grant. We also, as Nicolette talked about, got money from HRSA to do the Facilitator guide. And we got a little nervous when the grant period ended. What were we going to do? And the city of Tallahassee very graciously has taken over most of the funding. Also, the Tallahassee Senior Center Foundation. We've got some grant money as well from the Tallahassee Leon County Nonprofit Services Grant. So we're here. We've won a couple of awards. We're not going anywhere. So a number of moving parts to Upslide as well. I'll talk more specifically about the individual counseling and the Friends Connection in a moment. But social engagement support, so one-on-one support with folks. What is it they want to do? What are their interests? How can we match? And how can we help you get there? Nicolette had also talked about the challenges of transportation with older adults, and we certainly see that. And what we do is if someone needs help, for example, filling out the Dial-A-Ride application, we're going to help them do that. And luckily, licensed clinical social workers can certify those, which saves people a step. So I can certify it, and they don't have to worry about going to their doctor or some other provider. And then once they're accepted, we can provide Dial-A-Ride tokens so that they don't have to worry about that piece of the puzzle. If they want to come here 3 days a week, and it might otherwise be financially difficult, we try to remove that worry. Information and referral, of course. If you can't get your basic needs met, you're not going to be able to worry about being more social. So we try to do that so that people can just concentrate on that part of their wellness. So we weren't able, of course, during COVID to do social outings, but we wanted to bring other avenues for people to be social. We wanted to increase the amount of FaceTime people got with folks because that's how friendships are formed. But we also wanted to give more natural, if you will, social interactions. Friends Connection is magical and wonderful, but it is structured and therefore a little unnatural, if you will. So we wanted to give more opportunities for folks. So we do these wonderful social outings. We went to a goat farm. Nicolette brought us a sound healing workshop. We just did a music therapy series. We've done some really cool stuff. We have a monthly game day. And of course, there are those intergenerational opportunities. During COVID, during the 13 months that the senior center was closed, we had a buddy program with the College of Nursing at FSU. And we recently had the Stride students come in with Friends Connection. And oh my God, people love that. Everyone just left. You could just feel the energy in the room. It was really a wonderful thing. And everything that we provide is at no cost to our participants. And the criteria, if you will, to participate is really very loose. Be older than 50 and be lonely, basically. Have a desire to engage with others. When people are coming to our in-person programming, they do need to be able to get to us either independently or with assistance and be appropriate, right? In a group setting, be appropriate within, the confines of the senior center. We have had and do have people with mild cognitive impairment come. That's fine if they've got a caregiver, as long as they're able to navigate well, totally fine. We get a lot of self-referrals. Sometimes people ask that because there is a stigma to loneliness. Those and the referrals from healthcare providers, those are our best referrals, without question. Those are the ones that stick. So individual counseling. So I do some of the counseling, but Nicolette, as our program counselor, really does the bulk of the individual counseling. And the one thing I'll say about that, since y'all can read these other things that we do, is that both Nicolette and I are trained in EMDR, which is a treatment for trauma. And a large amount of our folks come to us with childhood trauma specifically, but just trauma through the lifespan. And for the first year or so, more than that, we weren't really able to address it. And then we're like, why aren't we? If most folks are coming in with this. So now we're able to do that. And that's been wonderful because again, there's a cost barrier there. You're doing this no cost and it's not cheap out in the world. So Friends Connection is where it's the first point of contact for most of our participants. It's where most of our participants are. And we do have overlap between the individual counseling and the Friends Connection. But it really is the heart and soul, which where everything happens. We have a group that meets here at the center on Monday, one on Thursdays. I facilitate one, Nicolette does the other. We also have one that meets virtually every Tuesday, and I facilitate one at the Lincoln Neighborhood Center twice a month. So everything is geared towards sharing and social interaction, but there's also this holistic approach for introspection and building on strengths and identifying strengths and giving novel experiences like dulcimer workshops and giving therapeutic interventions and teaching social skills and things like that. But the most important thing I think that we found is that, I don't want to say we, because I don't think it's us, they created a community. The help and support and the love that they give each other is astounding and beautiful. And also we try to make it fun. Like there are times when things get deep, when things get heavy, when things get sad, but we try to make it be fun whenever we can. And we just do a variety of activities from games to the therapeutic. So I wanted to talk briefly about the Facilitator Guide. I'll kind of skip over my spiel for this because Nicolette talked about it. But just to give you an idea of what's in it, it really is designed to help people replicate specifically the Friends Connection aspect. And we wanted to have it be where mental health professionals could do it or lay people could do it, because some senior centers, for example, have a lot of volunteer run activities. So we wanted to keep that in mind. And we have an activity catalog that has very detailed instructions for how to do about 60 of our activities. And we have it broken down so that you can do it in person or you could do it virtually, because virtually probably is not going anywhere anytime soon. So I wanted to give you some statistics. And here's a great photograph that shows sort of the melding of the worlds. This was one of our drive-through events during the time that we were closed. We would give a lunch and a resource bag. So we did do a lot of reach resources as well. So I just wanted to show this to you so you can see that we've done what we've set out to do, that people are having improvement in their quality of life and they're feeling physically as well as mentally healthier, and that they form friendships. So you might notice the friendship numbers a little lower than the others, but we just recently had a gentleman who was interviewed for when we won one of our awards, and he said, I don't have friends outside of the group now, and it's okay. He still feels very connected to folks and feels like he's part of that community, and he said it's enough. So, we might see that number and go, but the magic really does often happen in that group. So I wanted to share, speaking of magic and speaking of kind of hearing it through from the mouths of our participants, I mentioned that we did this music therapy series. So we had some music therapists come in, do a 4-week series. And what they did during the last week was she asked them to just write down and brainstorm a few words, a few phrases about what is the experience of being in a Friends Connection group. So I wanted to share with you just some of the things that they said. And that the power of love was one of the things that generated a lot of discussion, and just the comfort and the sense of welcoming that they feel. It's the most welcoming group I've ever facilitated in my life. And that's not an exaggeration. So then after all this brainstorming and what is the experience of a Friends Connection group, they wrote a song together. So I wanted to share that with you. So it's to the tune of You've Got a Friend. And this is what they came up with. And they were very invested in this process. And you'll note, I just want to point out the last line is you are a friend. And in the song, it's you've got a friend. And there was a lot of discussion about that. And they decided it had to be you are a friend because that's sort of like it's an identity. It's not like you've got a friend, yeah, I'm here. It's no, you are my friend and I am your friend. Like it was a statement of identity. And that was very important to them that be that way. So I debated giving you quotes from our evaluations that we do every 3 months, but I thought this might be more illustrative of what the experience is for them and the connections that they forge and that it enhances everything about their lives. So that is what I had for you. So thank you so very much for your attention.
Well, thank you for sharing all of that with us. I was actually going to ask you about how you're capturing impact, and you covered that there toward the tail end. And, to see 90% improvement in quality of life and 85% informed friendships, and, it sort of speaks to the impact of this beyond just what's going on within each session or a sort of a truncated amount of time that is impacting people beyond that. And I know that's obviously ultimately the goal, but it was very, very impressive. So with that, I want to open up to questions or comments or thoughts. So you can feel free to put these in the chat or just unmute and speak up. And we're happy to do that for the next 10 minutes.
I wanted to thank the speakers as well. That was just such an exquisite demonstration of true community partnered work that is mission aligned, but also meets the community where they are. And just outstanding. Thank you so much. I feel like I have to say hello to Dr. Ken Brummel-Smith, our special guest today. And I know he has a question too. I have a question about the slide you were showing, Nicolette. I think it was from the AARP, the domains of livability that you were talking about, and you're aspiring to help people with all the different domains. And this might be a dumb question, but are those domains, are they evidence-based? Are people working on interventions to try to achieve those domains? And if so, have those domains been linked to, longevity or quality of life and things like that?
Yeah. I didn't come in with a lot of background knowledge with that work. I just kind of see the alignments. I know they did a community needs assessment. That's kind of the start to understand nuances of each locality that's pursuing this work. And so they're trying to fill those gaps in based off of specific geographical areas and the uniqueness of that community. But I'm not sure about the background. I should learn more about that. I'm glad you asked.
Well, the reason I ask is that could be an opportunity for FSU to really try to, take a systematic look, like you've already started, obviously, at, whether or not those domains are being achieved and how we can help, disseminate, deploy interventions that would help people achieve functioning in those areas. It's just a thought. Thank you. I think Dr. Brummel-Smith has his hand up.
Thanks. Wow, that was an amazing presentation by all of you, and I'm just so impressed by all the things that you're doing. I live in a rural county in Northern California that's over 6,000 square miles with only 43,000 people, and I just wish we had a tenth of the things that you're doing in all these rural areas where you're working, and a hundredth of what you're doing at the senior center. It's amazing. The one thing I would add to your presentation, Melanie, on the physical activity is pickleball. When I was
Yes.
on the board of the senior center, I used to hear about pickleball all the time during the program reports. And when, I was playing competitive racquetball at FSU against all these college players, so I was pretty good. And I decided when I retired, well, I'll go play pickleball. And I walked into the senior center, and there's all these old people, and they're overweight and hobbling. And I thought, God, I'm just going to squash these people. And I immediately got squashed by them. They were so good at playing. So now I've become a pickleball addict. And in fact, I'll be talking to Paul and to Nicolette and maybe Heather and Lynn Panton at Exercise Science about a project idea that the Florida Association of Homes for the Aged has to try and get funding from the Medicaid insurance companies, which fund long-term care, to fund the building of pickleball courts at long-term care facilities to get the staff playing, and for CCRCs to get the independent living and assisted living people to play. Because there have been some small reports showing that pickleball has the greatest uptake and adherence of any physical activity among older adults. So, if we could show that through fostering the building of courts, I think it would be a really great opportunity for FSU to do some good research. Anyway, thanks so much. It was a wonderful presentation.
Anyone else? Feel free to put a question or comment in the chat. I do see that Nicolette has added several links. Someone requested for various things, so thank you for doing that.
I have one more question, which particularly pertains to the rural activities. Here, I'm in the Rotary Club, and we've really been pushing, trying to reach out to people to get their COVID immunizations. And because it's a very rural area, there, are the kind of common political divides that you see with large numbers of conservative people. So it's been a challenge. And I was just wondering, in your rural initiatives, did you run into any types of politically based resistance to some of the ideas? I mean, some of the ideas on the face of them seem so obviously correct, but that doesn't mean that people will actually accept it that way. I was just wondering whether that played any role.
That's a great question, Ken. Nicolette, you have to correct me if I'm wrong. We did try to steer away from anything that had a hint of, political issues. So we saw the same COVID resistance up here, but we didn't really address that. So I think our issues are so generic, we have not seen anything. One thing I was going to mention with the couple minutes we have left is that, needless to say, when you look at our projects on paper, they were great. They're all encompassing, and we've had great success. COVID, of course, like everything, disrupted many of our projects. The one I'm most involved with is the training of home care workers in dealing more effectively with family issues. And we've had to basically, for a number of reasons, staff shortages, lack of staff time within the home care industry, we had to switch to putting all of our new curriculum online, which we're still doing, and then offering that education to the home care workers basically on their own time schedule. So we'll hopefully have some success with that. But and Hearst has been very understanding as a funding organization that they know. I think in a lot of ways, doing it online or using telehealth more robustly is actually for the better. So in many ways, COVID may have enhanced the project. Well, we'll have to see at the end, but there have been challenges. Nicolette alluded to a few, but that's the nature of the game. The challenges can open new doors for you.
Thank you. To address Dr. Bromwell-Smith's question, there was, I think, issues that we heard about was a lot of staff turnover with requiring vaccines and certain people that were not comfortable with that, and they left their position. And yeah, definitely a lot of hesitancy in small towns. People talk, their cousin's not going to get one, they're not going to get one. So yeah, we definitely heard anecdotally some stories about that from our clinical sites.
Did you run into problems with the telehealth outreach because of limits in broadband or not having computers too?
Absolutely. And it actually ended up being very resource intensive. For what was happening is patients would come in and meet with a staff member at North Florida one-on-one to help them learn how to connect via telehealth, integrate with the EMR, with their specific platform, learn how to use their blood pressure devices. And it really helped a handful of people, but it wasn't really realistic for that to happen with, their entire older patient population. But we learned a lot through that process.
Well, thank you for that. We're at the top of the hour, so I want to respect everyone's time, but I want to thank all of our presenters here. This was wonderful information. I know I appreciate hearing about all that you're doing. And thanks for the great questions and comments as well. So thanks to everyone for attending, and look for another one of these in about a quarter. Thanks, everyone.
Thank you.
Thank you, Dr. Howard.
Thank you all. Really appreciate it.